Hi, this is Dr. Reynaldo ROJoson, Director of ROJoson PEP TALK. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the PEP TALK. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I have been tackling health disorder and health issue courses. This may take 3 years or longer. My pep talk today is entitled Fundamentals and Generalities in the Medical Management of Goiter, Part 1. This is part of the health disorder course. The empowerment objective is for the lay people to have an understanding of the fundamentals and generalities in the medical management of goiter. The contents for the part 1 will be what is goiter, what are the common types of goiter, what are the causes of goiter, how common are the goiters. Part 2, clinical diagnosis of goiter, paraclinical diagnostic procedures for goiter, and part 3, treatment for goiters and health restoration and maintenance. For the definition of terms in the title and delimitation of coverage of talk, fundamentals to mean simplest and essential facts and theories which can serve as a basis or foundation and support for advanced information. The word generalities to mean general statements of information, not covering specifics and details. Medical management, diagnosis, and treatment by physicians. Let's start with what is a goiter. There are a lot of definitions given to the word goiter that often leads to confusion among the lay people as well as the health professionals. The definitions can be as the word goiter was first used before and as it is used now. First of all, goiter refers to something wrong with the thyroid gland, a butterfly-shaped organ located in the base and central part of the neck. The thyroid gland is a vital organ. Vital means one that is needed to survive, that regulates metabolism, growth, and development of the human body. The thyroid gland makes, releases, and controls thyroid hormones that control metabolism. Metabolism is a process where the food taken into the body is transformed into energy. This energy is used throughout the entire body to keep many of the body's systems working correctly. There are 2 concepts of goiter used by other people. One concept is the connotation that it is a benign, not a malignant, and not a cancer disorder of the thyroid gland. The backstory here is that there was a time when iodine deficiency was very, very common as a cause of thyroid enlargement. Thus, the connotation of goiter referring to iodine deficiency goiter. The other connotation is that goiter is an enlargement of the thyroid gland. In the internet, the word enlargement is commonly used to describe the presence of goiter. Enlargement has the connotation that the whole thyroid gland is enlarged or increased in size without nodules. In reality, abnormalities in the size of the thyroid that connote a goiter is present can be of 2 types, enlargement and nodule/S or presence of nodules/S. Both can present as an abnormality of the thyroid gland or goiter, but they have different implications in terms of possible causes. At this point, my 2 cents worth is to just define goiter loosely as any disorder in the thyroid gland. I saw one site in the internet that defines goiter as an irregular growth of the thyroid gland. This is by Mayo Clinic, rather than enlargement of the thyroid gland, to which I initially prefer and appreciate. However, on second thought, I will just stick to goiter as any disorder in the thyroid gland, as not all goiters will have irregular growth or any growth for that matter. One can have a goiter in which there is no physical growth of the thyroid gland, and yet it is producing abnormally high and abnormally low levels of thyroid hormones. To repeat my 2 cents worth on the definition of goiter, it is any disorder or a medical condition or a disease in the thyroid gland. A medical disease is a more specific term compared to a medical disorder. A medical disease is characterized by specific symptoms and signs that identify it as an abnormal entity in the body. A medical disorder is any abnormality or disruption in the normal structure and or functions of the body, not pinpointing to a specific entity yet. A goiter can be one that has diffuse enlargement, nodules, and or no changes in the structure of the gland, but there is abnormality in the secretion of the thyroid hormones. A goiter can be benign or malignant or cancer. Now let's go to the next topic. What are the different types of goiter? Goiter can be classified into several categories by clinical presentation, whether diffuse or nodular goiter, euthyroidism, hyperthyroidism, and hypothyroidism. By general categories of diseases, whether malignant versus non-malignant disorders, hyperthyroidism versus hypothyroidism, and by names of specific disease. By clinical presentation, the thyroid gland has both structure, which is the butterfly-shaped organ at the front, base, and center of the neck, and it also has function, which secretes thyroid hormones. It can have abnormality in both structure and function, either singly or in combination. So some classifications or categorization of goiter. There is abnormality in function, meaning there could be hyperthyroidism or hypothyroidism, or it could be also normal, okay, euthyroidism. There could be abnormality in the structure, just the structure, either enlargement or nodule formation, or it could have abnormality in both the structure and function, meaning it's combined or simultaneous. Another class categorization of the types of goiter. Goiter without structural abnormality, either enlargement or nodule, but with oversecretions or undersecretions of the thyroid hormones. Goiter with structural abnormality, either enlargement or nodule, but without oversecretion or undersecretion of thyroid hormones. Goiter with structural abnormality, either enlargement or nodule, with oversecretion or undersecretion of thyroid hormones. So another clinical classification of goiter, you have the diffuse toxic goiter, means you have diffuse enlargement of the thyroid gland with hyperthyroidism. Toxic means the presence of hyperthyroidism. Diffuse non-toxic goiter with diffuse enlargement but without hyperthyroidism. So it could be non-toxic, could either be euthyroidism or normal, or hypothyroidism. Nodular toxic goiter, nodule means with nodules with hyperthyroidism because of the word toxic. Nodular non-toxic goiter with nodules without, non-toxic means without hyperthyroidism. It may be euthyroidism or hypothyroidism. The definition of diffuse enlargement is the major lobes of the thyroid glands, such as the right and left lobes, are almost symmetrically enlarged or increase in size and without nodules. The definition of nodules means the presence of nodule or nodules or lump or lumps or dominant mass or masses. Another kinds of classification or categorization of the goiter, whether there's cancer or not cancer, and whether there is hyperthyroidism or hypothyroidism. The other types of categorization of the types of goiter is by the names of the diseases of the goiter. Okay, this is usually published in the WHO-ICD International Classification of Diseases, and they're also popularized by thyroid experts, which, as a word of caution, which may not jibe with each other. Example of names of specific diseases of the thyroid, of the goiter: congenital iodine deficiency syndrome, iodine deficiency goiter, endemic iodine deficiency goiter, diffuse non-toxic goiter, or the so-called diffuse colloid adenomatous goiter, nodular non-toxic goiter, which could be colloid cyst, solitary colloid adenomatous nodule, multiple colloid adenomatous goiter. Hyperthyroidism or Graves' disease, hyperthyroidism without specifying as a Graves' disease, hypothyroidism, thyroiditis, acute thyroiditis, subacute and chronic thyroiditis, follicular adenoma, Hurtle cell adenoma, different types of cancers of the thyroid gland presenting as a goiter, papillary thyroid carcinoma, follicular thyroid carcinoma, Hurtle cell carcinoma, medullary thyroid carcinoma, and anaplastic thyroid carcinoma. Here is my simplified categorization and classification of common types of goiter. I usually use this clinical classification of goiter. DTG means diffuse toxic goiter. DNTG, diffuse non-toxic goiter. NTG, nodular toxic goiter. And NTG means nodular non-toxic goiter. Okay, but these are clinical classification. Okay. So as I said, the definition of diffuse enlargement, the major lobes of the thyroid glands, such as the right and left lobes, are almost symmetrically enlarged or increase in size and without nodules. Okay. The definition of nodules, the presence of nodule, lumps, and dominant mass or masses. So this is an illustration of a diffuse enlargement. Okay, so here illustrates a normal sized thyroid gland, the right and the left lobe. And there is almost symmetrical enlargement of the two lobes, like this. Okay, this is the normal outline of the normal size, and then there is almost symmetrical enlargement of the two lobes. Okay. Definition of nodules, normal size, then one lobe is enlarged disproportionately enlarged compared to the other side, let's say 2 times, 3 times enlarged, this usually contains nodules so that it will appear as enlarged lobe of the thyroid gland. Okay, but this is classified as nodular goiters, more so if there are palpable nodules, either solitary or multiple. So this is classified, these two are classified as nodular goiters. Okay. So just to show the difference, diffuse goiter, okay, both lobes are almost symmetrically enlarged. Nodular goiter, one lobe is extremely enlarged or prominently enlarged compared to the other one, okay, and more so if there are palpable nodules on the surface of the thyroid gland. Okay. So when you have diffuse enlargement, usually it connotes the following entity: hyperthyroidism, hypothyroidism, or euthyroidism, depending on the associated symptoms and signs. If you have nodule formation, it's a question of whether there is malignancy or non-malignant disorders. The common diseases that I usually diagnose, which can be recognized clinically and relatively common in the community: hyperthyroidism or Graves' disease, hyperthyroidism without the typical Graves' disease, that's why it's called unspecified, hypothyroidism, acute thyroiditis, chronic thyroiditis, malignant nodules or thyroid cancers, papillary carcinoma, follicular carcinoma, anaplastic carcinoma, medullary carcinoma, non-malignant nodules or conditions: colloid cyst, colloid adenomatous nodule, multiple colloid adenomatous goiter, and diffuse colloid adenomatous goiter. These usually present as a diffuse enlargement of the thyroid gland without symptoms of hyperthyroidism. Note, currently, from the past up to now, there are no uniform answers or lists among physicians and medical organizations on the different types of goiter. Medical organizations have different listings. Thyroid specialists have different listings. Practicing physicians have different listings. This really causes a lot of confusions among medical practitioners and patients. So please take note of that. So to simplify things, if there are different terminologies used, so the bottom line is just to determine the following: whether the medical condition or medical disorder involving the thyroid is a disorder of functions, a disorder of structure, or both, and whether there is hyperthyroidism or hypothyroidism or not, and whether there is malignancy or not. What are the causes of goiter? So the next topic. In general, the risk factors include genetic predisposition, environmental influence like lack of iodine intake, excessive exposure to radiation to the neck, stress, etc. Note, however, a lot of goiters have no definite known cause. The more specific causes for the specific diseases are the following. Iodine deficiency goiter is due to a lack of iodine intake. Colloid adenomatous goiter due to some physiologic changes or degenerative conditions. Cancer due to genetic mutation with genetic predisposition and radiation exposure, especially to the neck. Chronic thyroiditis, usually caused by an autoimmune disease. Acute thyroiditis, infection. Hyperthyroidism caused by immune disease. Hypothyroidism, iodine deficiency, or physiologic. Except for iodine deficiency goiter due to the lack of iodine intake, which can be prevented, for the other diseases, one, nobody can predict when one is going to have a thyroid disease, and two, the causes are realistically difficult to identify and to control. Healthy lifestyle with adequate iodine intake is the best bet against thyroid diseases. However, there is a percentage that one cannot prevent a thyroid disease from occurring through healthy lifestyle. So how common are the goiters? Based on my personal experience in my medical practice, iodine deficiency goiter is practically non-existent anymore because of iodine intake and iodine fortification in foods. Colloid adenomatous goiter is most common, okay, about 90%. Cancer, only about 5%. Hyperthyroidism, 3%. Chronic thyroiditis, 1%. Hypothyroidism, 1%. So takeaway, summary for the first part of this pep talk on goiter. What is goiter? What are the common types of goiter? What are the causes and how common are the goiters? Okay. Part 2 will be taken up next week, and part 3 will be on the week after. Okay. So what are the common types of goiter? There's so many types in terms of okay, let's go back. What is a goiter? Any disorder of the thyroid gland, not referring exclusively to a benign disorder, not referring exclusively to a diffuse enlargement, but include nodule or lump formation. What are the common types of goiter? So many types in terms of disorders in structure and functions and in terms of specific diseases. Diffuse enlargement usually implication on hyperthyroidism and hypothyroidism, and most of them will still be euthyroidism. Nodules or masses, either benign or malignant mass. Causes of goiter. In general, the risk factors include genetic predisposition and the environmental influence, like lack of iodine intake, excessive exposure to radiation to the neck, stress. Again, take note that a lot of goiters have no definite known cause. How common? Fortunately, majority are not cancers. Okay. Colloid adenomatous goiters, the most common. Cancer only about 5%. Hyperthyroidism, 3%. Chronic thyroiditis, 1%. And hypothyroidism, 1%. Takeaway in relation to the patient empowerment, be always in touch with reliable medical information on fundamentals and generalities in medical management of goiter. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in the medical management of goiter. With that, I end my pep talk. Fundamentals and Generalities in Medical Management of Goiter, Part 1. I hope I have empowered you to have a better understanding on the fundamentals and generalities in the medical management of goiter. So thank you and good day. Mabuhay kayong lahat.